What is melasma? Melasma, a prevalent skin issue characterized by the appearance of brown to gray-brown patches on the face, typically affects areas such as the cheeks, chin, nose bridge, forehead, and above the upper lip. It is also referred to as chloasma or the mask of pregnancy when observed in pregnant individuals. While both men and women can experience melasma, it is significantly more prevalent among women. The American Academy of Dermatology reports that 90% of individuals diagnosed with melasma are women. What are the patterns of melasma? Number 1. Centrofacial pattern. Melasma manifests on the forehead, cheeks, nose, and upper lip. Number 2. Lateral cheek pattern. Melasma is evident on both cheeks. Number 3. Malar pattern. Melasma occurs on the cheeks and nose. Number 4. Mandibular pattern. Melasma develops along the jawline. What are the types of melasma? There are 3 types of melasma categorized based on the depth of the pigment, which can be determined using a Wood's lamp emitting black light. First one is epidermal melasma. This type of melasma presents with a dark brown color, well-defined borders, becomes apparent under black light, and may show positive response to treatment. Second one is dermal melasma. Dermal melasma exhibits a light brown or bluish color, blurry borders, shows no distinct difference under black light, and tends to be less responsive to treatment. Number 3. Mixed melasma. This is the most common form, characterized by both bluish and brown patches, displaying a mixed pattern under black light, and showing some degree of response to treatment. What causes melasma? Melasma has 2 primary causes: radiation exposure, including ultraviolet, visible, and infrared light, and hormonal fluctuations. Exposure to ultraviolet and infrared radiation, particularly from sunlight, exacerbates melasma. Other potential triggers for melasma include anti-seizure medications. Certain drugs used to manage seizures, such as clobazam, may contribute to melasma development. Next one is contraceptive therapy. Melasma occurrence has been associated with the use of oral contraceptive pills containing estrogen and progesterone. Next cause is estrogen or diethylstilbestrol. Diethylstilbestrol, a synthetic form of estrogen commonly used in prostate cancer treatment, has also been linked to melasma development, highlighting a correlation between increased estrogen levels and melasma. Next reason, genetics. Approximately 33% to 50% of individuals with melasma report a family history of the condition. In the case of identical twins, the majority tend to both have melasma. Next reason is hypothyroidism. This condition arises when the thyroid gland functions inadequately. Next cause is LED screens. Melasma can potentially be triggered by the LED lights emitted from electronic devices such as televisions, laptops, cell phones, and tablets. Next cause is pregnancy. The exact cause of the mask of pregnancy remains uncertain. However, experts speculate that elevated levels of estrogen, progesterone, and melanocyte-stimulating hormones during the 3rd trimester could be contributing factors. Next reason, hormones. Hormones like estrogen and progesterone may influence melasma development in certain individuals. Postmenopausal women who receive progesterone therapy have been observed to develop melasma. Additionally, elevated levels of estrogen receptors are typically found in melasma lesions of non-pregnant individuals. Next cause is makeup cosmetics. Certain cosmetics can trigger a phototoxic reaction. Next reason is phototoxic drugs. Certain medications, including some antibiotics, nonsteroidal anti-inflammatory drugs, NSAIDs, diuretics, retinoids, hypoglycemic agents, antipsychotics, targeted therapies, and others, can render you sensitive to sunlight. Next cause is skincare products. Products that generally irritate your skin are likely to exacerbate melasma. Next cause. Soaps. Certain scented soaps are believed to either cause or worsen melasma. Next cause. Tanning beds. The UV light emitted by tanning beds can cause significant damage to your skin, comparable to or sometimes even worse than sunlight, exacerbating melasma. Let's talk about treatment and prevention of melasma. Treatment may not always be necessary for melasma if hormonal changes, such as those experienced during pregnancy or while taking birth control pills, are the cause of melasma. The condition typically fades after delivery or upon discontinuation of the medication. To prevent melasma, dermatologists often advise using a high SPF sunscreen. For some individuals, melasma may persist for years or even throughout their lifetime. In such cases, seeking treatment to diminish or remove the patches is an option. However, it's important to note that not all treatments are effective for everyone, and even after successful treatment, melasma may reappear. Treatment options for melasma can include hydroquinone. Physicians frequently prescribe hydroquinone as the initial treatment for melasma. Available in lotion, cream, or gel forms, hydroquinone functions by reducing the pigmentation of the affected skin patches. Individuals can directly apply the hydroquinone product to the discolored or uneven areas of the skin. It's important to note that hydroquinone is only available with a prescription. Next treatment: corticosteroids and tretinoin. Both corticosteroids and tretinoin are available in creams, lotions, or gels. These medications can aid in lightening the color of melasma patches. Next treatment option may include combined creams. In certain instances, a dermatologist may opt to prescribe combination creams known as triple creams, which typically include hydroquinone, corticosteroids, and tretinoin in one formulation. Additional topical medications. In addition to or as an alternative to other medicated creams, dermatologists may prescribe azelaic acid or kojic acid. These acids are effective in lightening the dark areas of the skin. Other medical procedures. If topical medications prove ineffective, a dermatologist may suggest procedures such as chemical peel, microdermabrasion, light therapy, laser treatment, dermabrasion. Some of these treatment options carry potential side effects or may lead to additional skin issues. It is advisable to consult with a doctor or dermatologist regarding potential risks before undergoing treatment. For individuals with a history of melasma, they can take steps to avoid triggers by limiting sun exposure, wearing a hat when outdoors, using sunscreen. Thank you for watching this video. Don't forget to subscribe my channel and press the bell icon.